Hey guys, it's Jay. Hashtag Student Nurse RN coming to you live with another great video. Got my coffee this morning. So anyway, how is my inspiring nurses doing out there? My name is Tiara. For those who do not know, I am a update. I passed my boards yesterday, y'all. Yes, all 265 questions. And today's video is on how to pass your boards on the first try, all 265 questions. So y'all, yes, we're gonna just jump into this video because I'm so freaking excited to explain all this, guys, to you and really quickly. First of all, I'm excited that I had this opportunity. I've been pursuing RN for a long time. Yesterday I took my boards. I drove an hour and a half away to a metropolitan area because when you get ready to take your boards, y'all, everybody's probably going to be testing at the same time as you. So when you finally get your ATT code, your eligibility to go ahead and test and register for your exam, your testing sites will pop up for your surrounding areas, and it will show you when the dates that they have seats available, because everybody's trying to test at the same time. So it's not going to be a lot of seats probably at the testing center that's like right by your house or something like that. So sometimes you really got to do a drive. Like one time I drove all the way to Maryland just to take one of the an exam. This time I had to go all the way to Richmond, which the drive was a little bit crazy because it was like I haven't been on a 5-lane highway in a minute, y'all. I was so freaking dizzy watching those cars drive so fast by, and I'm in the lane trying to pay attention. But once I got there, first of all, I was the first tester there. You want to arrive early, and the reason why I say that is you'll reduce a lot of anxiety when you're the first one in the door, and you are prepped. So when I mean prep, you don't have anything when you come into the testing center. Don't wear anything when writing on it. Don't wear like a whole bunch of jewelry. If you have tattoos, cover those tattoos up. Make sure your clothes are loose because they're gonna keep checking you, like if you're visiting somebody in jail. That's how they do it. They take a picture of you, they get a fingerprint, palm print. I had to do my palms every time I leave the testing area for a break. They escort me. Everything goes in your locker, and if you have any electronic devices, it goes in a sealed bag, and you cannot open that bag until the end of your test. So if you don't have a vehicle, try to find somebody that would be able to drive you the distance if you need to drive a distance to take your boards, which I'm hoping you guys can take your boards in your local test area near your house because that's convenient, right? But I drove all the way over there, and like I said, I was the first one there. I was there before all the workers got to work. So when they opened up the door, I was the first one to get my stuff in the locker, follow the instructions, let them check me, let them take pictures of me, let them check every ID, whatever they had to do to verify that I am me. Then I was able to be the first one to sit at my table, and I'm so glad. Now, my test started at 8 a.m., so I got there like 6:55, if that makes sense. I parked my car, I found out where the place was at, so that gave me time to find everything. I used the bathroom, and guys, here's another tip: do not bring everything in the testing center. You will get kicked out. They do not bring somebody who drove you to the testing center. You are not allowed to bring somebody from the outside into the testing center. If you got a big old purse, the lockers are not that big. The only thing I would suggest that you bring is like a little lunch bag, and I put my wallet in there and my phone, because those were where my snacks were at, and my water. Here's the thing. I ate my clinical food. Like if I had to wake up at 4 a.m. and go to clinicals, I have M&Ms and peanut butter sandwich. Now I know that sounds a little childish, but literally the peanut butter sandwich, that protein holds me over for hours. And so I ate 1 and then a half of another peanut butter sandwich, and I wasn't hungry at all. The only thing I was doing when I took my breaks and go to the bathroom, which you have to raise your hand, they have to come escort you out to the area, check you out, give you your ID, put your palms because you leave in the testing area. I went and took sips of water. Now also, here's another tip: please do not drink too much coffee at your before the morning of your board. You will be overhyped, and your anxiety level is already high. You might feel gassy, you might feel like you got to use the bathroom, because coffee is what, y'all? Diuretic. It does things to your body. So just be mindful how much caffeine you're drinking that morning. Be mindful of what you're eating. Make sure you eat something that's going to last. You may be there to 6 hours if you take your time and test. You have up to 6 hours, but you're probably going to be done in 4 hours. I was done in 4 hours, y'all. I had all 265 questions. Mostly all my questions were select all that apply. I know that sounds so sad right now. For those who are not in school yet, select all that apply questions are a question where you have to get multiple answers right. So you're picking multiple options rather than just one option A. Mostly all of them were like that. And there was a lot of don'ts, like what don't belong, like kind of questions, or priorities and delegation questions. Lots of surgical procedures. So med-surg and fundamentals are really big in nursing school and on your boards. So if you feel like you're competent in the other areas, specialty areas in nursing, then study your fundamentals and your med-surg, because those are your basics, your basic nursing knowledge as a new RN. Now it's different for LPN. I felt like my LPN boards, it was a lot more quicker. Once I sat down, I was done like in 2 hours, because my computer shut off like at 80 something questions. I was done. And I used to think that's how you pass your boards, but the boards is based off your competency level. So you have to be above your competency level. It's not a test that gives you an A, B, C. Okay, you got an A on this test. No, it goes by pass or fail, and they looking to see if you're above the competency level of nursing. So they testing your knowledge broadly. It could be anything on this daggone exam. Okay, it was a lot about management and all these different random. There was a couple of drugs on there that I wasn't familiar with. I always look for hints in drugs that I'm not familiar with, which at the ending of the drug, does it end with PAM? Does it end with LOL? We know it's beta blockers. You know, I look for the hints inside of my drug, and then I know the class, so I will go ahead and be able to answer that question, even if I'm not familiar with that particular drug. So that might help you with some pharmacology questions. Surgical procedures, sometimes is something that you can actually, if you don't know the procedure, you can actually still know. You should be able to have the knowledge at that point of pre and post-op teaching, or how to prepare the patient the day before surgery. You should know something about surgery at this time, because you're done with your program now. Anyway, so y'all, I had all 265 questions. Your girl kept having to go to the bathroom. Don't feel bad to keep taking breaks. I must have got up, I want to say 2-3 times. The last time I got up, guys, I felt like I was already filling my boards, because it never shut off. My computer kept questioning me. Like after I got to 180 questions, I was like, you know what? I'm just going to knock these last couple of questions out and just be prepared to tell my failure speech, because I felt like I really felt like I failed. Like, I was like, this is too many questions. I mean, anyway, so the last couple of questions, I was focused. I got myself together, because I don't stay in self-pity long, y'all. I'm the type of female where I'm like down, but then I'm like, nope, let's go Tierra, and I beasted out. So I beasted out those last couple of questions, and my computer ended with a survey, which I opted out of the survey. I didn't even want to be there no more. I was like, I don't want to do no survey. And I left, and when I got downstairs, I couldn't even drive. I was like, this is not safe. So I stayed at the testing site for additional 35 minutes and called my school, called my instructor. We had our certain instructors that you can call after your boards. Just they're gonna calm you down, or during your boards if you're on break, calm you down. But see, we couldn't have our phone in the testing site. So afterwards, I called my instructor. She was like, you study so hard. And the reason why they gave you all those questions was because you was getting all the hard questions right. So they kept questioning you harder with these select alls. And I'm like, oh my God, that makes so much sense. They was like, and so that's why the computer kept prompting you to question harder and harder and harder, and kept giving you questions. I was like, oh, okay, I get it. So anyway, so my school did the trick where you put your credit card in there, and if it doesn't take your $200, then that means that you passed your boards, and you have to wait 20 minutes after you took your test. So I had her check like 3 times. Like, I was like, no, I need to know for sure. Because at the time, I did speak to my husband before I spoke to my instructor, and he was like, just come home, baby. We're going to go look at the results together. And I was like, Anytime you leave a test like that, wait a little bit to drive home. If you know you can't find out if you passed and failed or not right away, your anxiety is through the roof at that time. Your judgment is not clear, and you want to be safe on the road. So if you got to take another 30 minutes to get yourself together, get yourself together, okay? All my nurses, take care of yourself, please. So, okay, right. So my teacher did the trick, and 3 times I was like, oh my God. Like, you telling me I passed? She was like, it's not taking my money, Tierra. You want me to check again? I was like, check again. I was a mess. But I had somebody on the phone to calm me down. Because a lot of times when you're going through all this nursing stuff, family members, they're helpful, but they really don't know what you the stuff you got to go through behind the scenes to get to that point. So it's really good to talk to somebody that is an expert. She's one of the teachers that teach NCLEX prep. So she preps us for our boards. And so she knows everything about the test and everything. And so I'm going to tell y'all right now how I passed this board on the first try, 265 questions. And I use ATI Board Vitals, which is something your school should give you access to. But if they don't, ATI is the exact company that creates the boards and the T's that you test into nursing school with. So Board Vitals is basically like a quiz bank. You could go in and test in any area of nursing you want to. As many questions as you want to. You want to do 300, go for it. You want to do 50 at a time. I guess I'm just can't sit down still all the time. So I just do like little questions at a time. Like I was doing 50, 50, 50, 50, 20, 20, 20, 20, because I need to take a lot of breaks. I can't sit there and do like a whole bunch of questions. One night it did go ahead and populate a practice exam for me, and it was 265 questions. And I was like, why is it giving me a practice exam? It took me 4 hours to do this. It would never end it. And look, it happened on my practice exam, and I had the same thing that happened on my actual boards. I was like, this is crazy. Anyway, I get bored quick. So after doing a couple of practice questions for a good 5 weeks, I was getting bored. So I used the book that my school gave me, which was really excellent, which was this book right here. Now this book, y'all, is life. And it has fundamentals, med-surg, maternity, peds, and psych. And then 2 big comprehensive practice tests, 100 questions each, in the back of this book. The rationales in this book is amazing. I paid $0 to pass my boards. Guys, I am cheap. I have a family. I need my money. So I cannot be spending my money, $300, $400, $500 on practice things for your boards. Your school should be the one giving you stuff to take these boards, because they also need to keep their accreditation. So they're going to prep you to make sure everybody passes on the first try. That's the goal for the trade schools. They are big for like making sure everybody gets certified or licensed, because that's how they keep their accreditation open. So they will prep the world out of you. They may not be the perfect nursing program or whatever, but they do prep you well for your boards. And that's what you want when you're looking for a nursing school. Prep. Do they prep you? What's the passing rate? You should always ask, what's the passing rate? If they say, oh, it's 100%, 100% out of what? How many people? Is it 100% out of one person that passed? Did you have one person in the class and she passed? Always ask questions like in depth. You want to make sure, you want to ask them, well, how are you prepping your students for the boards? And see what they say. Now, we were prepped for I was prepped for 6 weeks, because I started my last NCLEX prep a week earlier than my classmates, because I'm that extra, as they always say. I always get comments about, you're overachiever, you're extra, wherever. I'll be an overachiever with my boards, with my license, working, yay. Do what's best for you guys. So you guys got to know what kind of study type of person you are. Or like if you are the one that don't do good with just practice questions, you need somebody to sit down with you. Go to your school and let them know. Don't just do it last minute. Let them know, hey, I have to have somebody sit down with me, go over these questions, tell me why I'm getting them wrong. I need to focus on maternity. I'm not getting that right. That's not my strong point. And my school pulled all my statistic numbers on what was my highest score in the specialty area, what was my lowest. And also they can know in the nursing process, you know how you assess, diagnose, evaluate, and all that. My evaluation part I was scoring a little low, or real low on my evaluation part. So they could tell you by looking at your previous ATI test, what is your strong point and what you need to focus on. And so my first thing that I started with is doing a whole bunch of med cards. Pharmacology is not going to go anywhere. You're going to get drugs that sometimes you may not even know what the world is that drug. I had 2 drugs on my boards that I did not recognize. I was like, what the world is this drug? But when I get a drug question, I always look for the ending of that drug. If I see PAM, LOL, PRINE, I know my classes of drugs. That will populate my knowledge for that drug. Class. So drugs studied by the class. Don't study drugs individually, because it was too many drugs for you to know. It's millions of drugs that's out there. Not every nurse gonna know every drug, but if they know the class, they'd be like, oh, well, I know that this is the side effects of that drug. This is what it interacts with. Any drug is gonna interact with an NSAID. You're gonna give it an hour before, 2 hours after. It always, warfarin is another drug that interacts with a lot of drugs that you don't give with any other drug. But you're going to know this when you go through nursing school, the common stuff. Anyway, so I used that book that I just showed you, y'all. I'm going to show y'all one more time. This book was excellent. The rationales was amazing. Amazing, y'all. And y'all want to get material that has amazing rationales. ATI doesn't really have a strong rationale to a question when you get it wrong. And even if you get it right and you're doing your practice questions, still go back and say, hey, I guessed it right, but I really don't know that disease process well, and read the rationale. It will save your life. Now, I did this whole book the week before my boards, and I was grateful for it because your girl was knocking out questions, okay, because of this book. And I'm going to show you. It has math, but I have no math on my boards. I had questions. I didn't have no math. Now I'm thinking about it at all. I didn't have any audio questions. So everybody's boards are populated different, because I've seen some other people had their headphones on and doing audio. I have none of that. So my boards were populated different from everybody else's. So, and that's just based on the state. What else? So what else I want to tell y'all about your boards? So I think I told y'all everything. Now, your school pays for your boards, or they pay up to a certain percentage. So my school paid up to 75%. So I paid only $120. That was the only thing that I owed after the school paid for everything. They paid for my fingerprints, registration, everything I need to go ahead and take the test. And so I only paid that amount. That was it. So find out how much the school pays for as far as your boards before you look, when you're looking for a nursing school. Some schools will pay 100% for them. Some schools don't pay for them at all. You got to pay out of pocket. It's a very expensive test to take. So make sure you prepare before you take it, because if you have to retake it, that's all the money coming out of your pocket. And if you don't want the pressure of, you know, having like a job waiting for you and promises, like you already was setting up stuff for your life as if you was an RN already, don't do none of those things till after you pass your boards. Then once you pass your boards, you can actually get whatever job you want because you're actually licensed. I had the pressure because it's just me. Already I had a job already that was waiting on me. Already had things set up for me to get into, like my bachelor's degree. I had to be a licensed RN in order to do the RN classes in my bachelor's degree. So I had a lot of obligations already started. So I was like, maybe that was a motivation for me to pass it. I don't know. Anyway, pray before your boards. Can't forget to do that multiple times. You want to pray. And the day before, you don't want to do anything. Don't want to study. You want to eat. You want to sleep. Just chill. Like, just chill. Make sure your clothes is out early. Make sure you have a plan to get there, or alternative route if there's a construction or an accident. You want to make sure you read in the directions clearly on your instructions to take your boards, what to bring to the test center, what identifications they need. Make sure you read all that good stuff the day before and chill. And just say, you know what, from this point, either I got it or I don't. And just go with it, you know. And don't be afraid to put yourself out there sometimes. And take advantage of nursing school. Everything you're learning is definitely going to pay off later on when you have to take these big tests like the exit exam to get out of nursing school and then take your boards. Pay attention to the medications that you learn. Do drug cards. Do flashcards if you're a visual learner. I'm kinesthetic and visual. So, of course, anatomy, physiology, I ace because I like lab, and then I like, you know, visually seeing the cell, visually seeing what I'm learning. You could be auditory or whatever, tactile, whatever kind of learner you are. If you're auditory, you can record the lectures, record yourself reading the drugs, and then, you know, when you're in your car, you can replay your whatever you recorded. But if something is not working for you, change up your studying method. Don't just have one study material you're going off of when you're preparing for your boards. Always have more than one. You can have a book and maybe UWorld you use, and just use both. Interchange, like just use both. Don't just rely on one. And always look for good rationales, as I said. So anyway, I hope you guys are super happy for me, y'all. Like, your girl is official. Okay, I'm official now. It's done. I quit my job. I start Monday. So your girl had her first day. About to have her first day. I will go over that with you guys. My first week starts next week. If you got any comments or requests, or you want to know like anything else that I might not said in this video about your boards, hit me up. Let me know. I'm sure I could tell you. I've been on this journey for so long that I could tell you many things, but it's something, I don't know everything. So there may be something that, you know, I missed, or you want to know more about, and then I can kind of hit you up in the comments. But anyway, y'all, subscribe, like, and share. I'm going to try to bring y'all as much entertainment as possible, because I know some people be on here for entertainment purposes. So hello to my entertainment purposes. Hey, I accept all people. Yes, sometimes I could be a little extra. Yes, I do a little dance before I start my little video. Sometimes I ramble on. Sometimes I get off focus. Sometimes I'm like real focused. So yeah, that's just Tiara. That's how I was created. So anyway, I hope you guys really enjoyed it. Let's continue to grow this channel. Let's get the information out there. Get into school, y'all. If y'all sitting on the couch, don't be no couch potato this year. Get off the couch. Get into school. Even if you get started, start on your prerequisites, something. Get started this year. Like, everybody's in school now. Like, it's crazy. Grandma's in school. Uncles is in school. Everybody in school, y'all. So don't be the one sitting back regretting and watching everybody graduate while you sitting on the couch. I don't know who that message is for, but get off the couch. But anyway, nothing but God. Keep him first, and you guys will succeed. You guys have a blessed day.